So as we continue to live through a pandemic, there's another pandemic that I want to talk briefly about with you, and that's type 2 diabetes. And reality is, this is an illness that's really kind of, the prevalence is growing steadily, and it causes a lot of bad things. So I want to talk to you about specifically type 2 diabetes, and is there ways that you can reverse it? And there are. So let's dive right in. So the first thing is to understand what type 2 diabetes is. And what that is it's a chronic disease where your body really can't use the insulin appropriately or regulate glucose. And this really causes glucose to accumulate in your bloodstream. Your blood glucose levels rise, and if it's not treated, it's going to affect various parts of your body, including your immune system, your nervous system, the circulatory system, and really starts to cause damage that, if left untreated, is irreversible. Now, the exact cause of type 2 diabetes is still a little bit unknown, but there are obviously genetic factors and environmental factors that are involved here. And the important thing is these things are probably interrelated. So the first thing is insufficient insulin production. So insulin, like I said, is a hormone that controls the movement of sugar or glucose from your blood into your body cells. And this prevents a rise in your blood sugar levels because insulin really is preventing the sugar from accumulating in your blood. But what happens is when your body doesn't produce enough insulin, it causes sugar to accumulate in your bloodstream, and it also stops your body cells from getting enough glucose. A bigger factor in type 2 diabetes is insulin resistance, though. So here your body is producing enough insulin, but the cells are just not responding efficiently to the insulin. Therefore, you have a buildup of excess glucose again in the bloodstream. When this happens, your pancreas tries to overcome this resistance and produces more insulin. And unfortunately, this kind of wears out your pancreatic cells, where they can start really having problems producing enough insulin. So insulin resistance is a big factor in type 2 diabetes. So what are some risk factors related to type 2 diabetes? Well, obviously, genetics and the family history does play a important part. So, according to the American Diabetic Association, if you have a diabetic parent or sibling, then it really increases your risk of developing type 2 diabetes. It also affects different ethnic groups more than others. Those include Native American, Asian, African American, Hispanic, and Pacific Highlanders. Now, genetic conditions like hemochromatosis and cystic fibrosis, they can also damage the pancreas, which increases your chances of developing type 2 diabetes. Pregnancy, some women develop diabetes when they're pregnant. This is called gestational diabetes. And this is really thought to be because the hormones in the placenta interfere with the body's insulin response. And this interference results in an insulin resistance and ultimately the higher blood sugar levels. And unfortunately, women who develop gestational diabetes do have a higher risk of developing type 2 diabetes in the future. And also, according to the Center for Disease Control and Prevention, delivering a baby weighing more than 9 pounds also increases your risk of developing type 2 diabetes. Age is a risk factor. The older you get, the higher your risk of type 2 diabetes becomes. This is especially true for people 45 years or older. Obesity is a risk factor. Excess body fat triggers some inflammatory responses that really can cause the body tissues to develop insulin resistance. And this can cause you to really become diabetic if you don't lose the excess fat. Unhealthy diets contain a lot of fat, calories, and cholesterol, can cause your body to become resistant to insulin. And this also results in type 2 diabetes if you really don't address it. Poor physical activity is also another risk factor. So your body's tissues become more responsive to insulin when you exercise. And this reduction in insulin resistance explains why regular physical activity can really help reduce your risk of type 2 diabetes. Then another risk factor is you may have some type of hormonal imbalance. While this is rare, there are certain hormonal issues that cause you to develop type 2 diabetes. And this is because these hormonal issues sometimes cause insulin resistance. Examples include Cushing's syndrome, acromegalia, hyperthyroidism. So these are just some risk factors associated with type 2 diabetes. But let's talk about, what can you do about it? And there are things you can do about it. So there's many studies that show you can reverse diabetes, specifically type 2 diabetes. And the key here is to lose weight. This is because losing some weight will really help control your blood sugar levels better. It also helps to achieve a reversal if you lose enough weight. So some weight loss can help depending on how heavy you are. But the reality is you may actually reverse this by losing enough weight. The reversal is not easier though. It's difficult for people to lose weight, specifically when they have already developed diabetes, and they may actually be on insulin. The important thing is to earlier you can start to really work on your weight, the more successful you're going to be. There's lifestyle modifications that are going to help you lose weight, that can help reverse diabetes or type 2 diabetes. One of those is obviously reduction in your caloric intake, something called a very low calorie diet. Now, many studies have found that losing weight by sticking to a very low calorie diet can help reverse the type 2 diabetes. MRI findings show that the reversal is due to the weight loss causing a reduction in the amount of fat in your liver and your pancreas. This fat reduction then helps reactivate some of your pancreatic cells and really ultimately improves your blood glucose or blood sugar control. It also helps reduce your body's insulin resistance. There was a 2011 study that showed that a diet of 800 calories daily for 8 weeks helped really over 70% of the participants to achieve normal blood sugar levels without any medication. The diet consisting of 600 calories from shakes and about 200 calories from non-starchy vegetables. Now, the important thing to understand is these very low-calorie diets are really something that you probably have to have medical management. It can be very dangerous to try to undertake this on your own. Another thing is the success rate of pancreas reactivation is higher in people who have not had diabetes for many years. So again, it's vital to start a healthy weight loss plan as soon as you're diagnosed with type 2 diabetes, because the longer you wait, the more difficult it's going to be. And again, this form of dieting, I probably wouldn't recommend it for the average person. This is for extreme cases, because it's something you really should be speaking to your doctor about. Another thing you can do is simply become more physically active. This is another intervention that's been proven to reverse diabetes. And this reversal happens because exercise really helps your body become less insulin resistant. However, it's going to be challenging to lose enough weight to trigger reversal with exercise alone. On the bright side, combining exercise with healthy dietary modifications, it really increases your chance of reversing your diabetes. So it's a combination of becoming more physical activity, but then also really paying attention to eating well and eating healthy. And this combination really reduces your body's demand for insulin, which can help reverse your diabetes. In fact, according to a study, combining 10,000 steps daily with at least 2.5 hours of moderate exercise weekly and a calorie reduction of 500 to 750 calories can really help you achieve normal blood sugars without any medication. Fasting. So fasting is really going without food or drink with calories for a set period of time. It's really straightforward. It's kind of one of those things that a lot of people are doing now, intermittent fasting. But again, the amount of fast or the period of fast can be variable. But really, there was a study that showed that 3 24-hour fasts every week for several months resulted in 67% of the subjects achieving normal blood glucose levels without a medication, and the remaining 33% were able to stop taking 75% of their medication. So really reduce the reliance on medication. In addition to this, these participants were able to lose 10 to 18% of their body weight. There's another study that showed consuming minimal calories, again 500 to 600, for just 2 days helped diabetic people reduce their weight and blood sugar levels. So these findings are really valid for people to really, reduce their calorie intake for a period of time, and that reduction in caloric intake or fasting really can have a positive impact on your blood sugar. Another thing is bariatric surgery. So gastric bypass surgery has been shown to be really successful with reversing diabetics. Type 2 diabetics. So there was a study in 2010 that showed 72% of the participants achieved a diabetes reversal after 3 years. Now, despite the high success rate, gastric bypass is not without complications during and after surgery. So for instance, it totally changes how you eat because you can only eat small meals after the surgery. You'll also need to take nutritional supplements for the rest of your life to help really prevent nutritional deficiencies. And therefore, you really should go through thorough discussion about the risk benefits with your doctor before going through bariatric surgery. Now, some things that don't work, there is no magic pill that can cure diabetes. So you should avoid products that claim to cure diabetes. It's just that simple. According to the Food and Drug Administration, many products are illegally marketed to cure diabetes. Some of these products are unproven and may be dangerous. Again, these are your over-the-counter, unregulated type products, so I would be cautious in using those. In fact, the FDA also found that some of these products that are all natural, they actually contain prescription drug compounds that weren't listed in the ingredients. And this can obviously affect the medications you're taking in addition to this supplement too. So really, what's the key takeaway? Well, the key takeaway is that type 2 diabetes is really a pandemic. It's affecting all aspects of the world. We're finding more young people are having troubles with this. And understand there's no cure for type 2 diabetes, but really you can achieve a normal blood sugar and maintain it without medication. This is possible. And the key really to kind of this reversal is losing any excess weight and really being more physically active. And this will really help improve your insulin sensitivity and help reactivate some of those inactive pancreatic cells. Now, some of the successful reversal methods are extreme, like the gastric bypass or the very low caloric diet. So you really should be talking with your physician about the best ways to approach this and what are the best ways to lose some weight if you need to lose weight. But again, hopefully this helps. This is a very serious thing, and the long-term consequences of not addressing this is very detrimental to your health. So I would encourage you to take action and really understand you're empowered, that really through increasing your level of activity and really eating healthier food products, more than likely you can reverse this type 2 diabetes. So I hope this is helpful, and thank you very much.